PG Doctors NEET. It's your YouTube channel.
Hi doctor friends, welcome to my YouTube channel PG Doctors NEET. Today's topic is mental retardation. This is very important topic for the pediatrics and psychiatric question. So let us start without wasting of the time. What is the mental retardation? Mental retardation, and also it is called as general learning disability or intellectual disability or intelligence quotient IQ. The WHO definition for the mental retardation is the mental retardation in which significantly sub-average general intellectual functioning existing concurrently with deficits in adaptive behavior and manifested during the developmental period that adversely affect a child educational performance. The IQ can be calculated by this formula of the IQ is equal to the mental age upon chronicle age into 100. The mental age indicates here if a person having the IQ is 50 and it is 6-year old child, then you can calculate if IQ is given as 50 while that it is 6-year old child, that means chronological age is 6 year, that means mental age can be calculated, that means 50 upon 6 by 100, that means upon 100, that means the mental age of that person is the 3. If mental is given and chronological age is given, then you can calculate the IQ. So the classification given for the mental retardation, this was the order classification that moron, imbecile, idiot. This looks like a abuse, idiot. The start with the order classification. The idiot, that means the IQ of that person is 0 to 25 and its mental is below 2 year. And the imbecile, the IQ will be 26 to 50 and mental age of that person will be 2 to 7 year. And the morons IQ will be the 51 to 70 and the mental age will be 7 to 12 year. While that of the newer classification for the mental retardation is given as the if the IQ is less than 20, then it is called as profound MR, and if the IQ between the 20 to 35, this is called as the severe mental retardation, and both are under the custodian. Word is used custodian, that means the person are under the custody, that means he can't do anything with their own mind, they can do all things by the other, by the support of any other additional person. The trainable, the trainable, the IQ for trainable person or moderate MR is 35 to 50. The IQ given if 35 to 50, between them this is moderate mental retardation, and this person can be trainable. That means it can be trained. Educable, that means the IQ are under the or between the 50 to 70 are mild MR, and if it is 71 to 90 it is borderline, and if it is 90 to 109 it is average IQ, that means normal IQ. Below 90 is the sub average, and this is educable, that means you can educate that. Another classification for the mental retarded person is the Wessler's 4 IQ classification. In that, the classification on the basis of IQ start with the IQ less than 69, it is extremely low. 70 to 79 is borderline, and 80 to 89 is low average. 90 to 109 is average, and 110 to 119 is the high average, and 120 to 129 is superior, and more than 130 is the very superior. This is the best classification, and many questions asked in that chart. And another one is the most important is the older and this newer classification. Many times asked the idiot, imbecile, morons, custodian, trainable, educable, and the question is asked the about the IQ is given, and you have to given the mental is, chronicle is, and then the question asked about the person is imbecile, idiot, morons, or trainable, educable. So many types of variable questions are asked in the mental retardation in the PG exams. So make that notes very carefully. The also question asking about the most common cause of mental retardation. The most common cause of the mental retardation is the genetic condition is the Down syndrome and fragile X syndrome, and another one is the fetal alcohol syndrome. That means if the pregnant lady get alcohol, then the fetal alcohol syndrome will be the condition in the baby. And also the other cause of the mental retardation, if the illegal drug used by the pregnant lady, and if any case which damage the development of the brain, okay, and any brain disease, that means the meningitis, encephalitis in the baby, and the another form is the hypothyroidism, phenylketonuria, preeclampsia in the pregnant lady. That condition causes the mental retardation in the baby. And the most important in that is the Down syndrome, fragile X syndrome, and the fetal alcohol syndrome, and which can be cured. If the question is asking about that, which can be cured, then if the preeclampsia have in the pregnant lady, then we can treat the preeclampsia. And another, the phenylketonuria, This is the genetic disease but can be treated by preventing the amino acid containing phenylalanine. And another one is the hypothyroidism. Hypothyroidism can be treated easily, and this is the treatable mental retardation. That means you can treat it. The what the condition of the mental retardation in which the question is asked about the in which condition the IQ is very high. The IQ is very high in the case of the Ramu. Given the trick is the Ramu. Ramu, that means retinoblastoma, asthma, myopia, and the condition in which the serum uric acid level is the high. And the question is many times asked, and question is always asking like a circle. You can wondering in that question, but question is so simple. So this mental retardation is very important for your NEET PG, AIIMS PG, any types of medical PG exam, which are very important for you, and for also the MBBS student. The question also asking about the most common cause of mental retardation overall. Then this is the question is asking. Also, I am asking that the most common cause of mental retardation, if overall, then Down syndrome is the first choice, and the genetic cause, then also the Down syndrome. The if the inherited cause, the question is asking something varied, that the inherited cause, the mental retardation is the Fragile X syndrome. While that of the question also the eliminated disorder, then neurosis, and the incoparesis, lack of bowel control. Another, the fetal alcohol syndrome, this can be a treatable cause. So this is very important for you further PG exams. So carefully make a note of that. Thanks for watching my video. Have a nice day.